Good morning, everyone. My name is Christy Wooten. I'm the president of the Atlanta Press Club. We'd like to welcome you to our online newsmaker event, Will the Pandemic Reduce Mental Health Stigma? This is a special newsmaker produced in conjunction with the Atlanta Press Club and the Carter Center. Founded by former First Lady Rosalind Carter, the Carter Center's mental health programs work to promote awareness about mental health issues, inform public policy, and reduce stigma and discrimination against those living with a mental illness. Mrs. Carter has been a driving force for mental health for 4 decades, and during her time in the White House, she served as chair of the President's Commission on Mental Health, which resulted in the passage of the Mental Health Systems Act of 1980. During this unprecedented time right now, during the pandemic, online events such as these allow us to engage experts and top journalists in discussions about the impacts of COVID-19 upon the health and livelihood of journalists and people from all walks of life. Thank you for supporting the work of the Atlanta Press Club and for the Carter Center. And thank you to the Carter Center for presenting this panel with us. If you want to learn more about what we do at the Press Club, visit us at atlantapressclub.org and learn about the Carter Center's work on cartercenter.org or on their social media channels. Also this morning, we would like to extend a special welcome and thank you to our title sponsor, Wellstar Healthcare System. Wellstar has publicly addressed mental health issues surrounding COVID-19 since the beginning of the pandemic, and we acknowledge the work of Chief Behavioral Health Officer, Dr. Ryan Brashears, and his team. Thank you for your leadership on this important topic, Wellstar and Dr. Brashears. The Carter Center would also like to extend a special thanks to its partner, Janssen Neuroscience, a division of Johnson & Johnson. We are so excited to have this great group of people with us here today, and I'm going to announce our moderator is Nick Valencia, a CNN correspondent based in Atlanta. He will be leading the discussion. In 2019, Nick won an Atlanta Press Club Award for his reporting along the US-Mexico border. He has also covered race in America and issues that impact the Latino community. Everyone, please welcome Nick Valencia.
We'll pipe in here some crowd noise and some applause here just to make myself feel better ego-wise. Thank you so much. This is an incredible honor to be hosting this event with the Carter Center, and Mrs. Carter, I know her work has just been fundamental to decreasing the stigma. So we want to send a special thanks to her and hope she's watching right now. We want to get right into our panelists here and start with the esteemed Dr. Eve Byrd, Director of the Carter Center's Mental Health Program. She's also led the Fuqua Center, I hope I said that right, for late life depression, Department of Psychiatry at the Emory School of Medicine, and her work centers around what we're going to be talking about here today: eliminating stigma and improving access to mental health care in the US and globally. Thank you so much, Dr. Eve Byrd, for joining us. Our next guest, for me, doesn't need any introduction. I'm sure for a lot of you guys, if you follow journalism or have seen him potentially in pop culture movies, Nicholas Kristof has a great name, strong name. Columnist also for the New York Times, and an author along with his wife, Cheryl Wooden, of Tightrope. That's a book about the American working class families damaged as a result of decades of policy mistakes. He's won the Pulitzer Prize not once, but twice for his coverage of China's Tiananmen Square democracy movement in 1990, and in 2006, reporting in Africa on the crisis in Darfur. Welcome to Nick Kristof. And Shanti Das, music executive here, a pioneer, a woman also that needs no introduction, Atlanta-based, former music industry executive and entrepreneur, helped launch careers of people that may have been behind your favorite songs, TLC, Outkast, and helm marketing efforts at labels such as LaFace, Artista, Columbia, and Motown. In 2017, she spoke about this actually recently. I saw an interview that she did with a local journalist here. She started Silence the Shame, a nonprofit organization that focuses on education, awareness, and eliminating stigma and providing programming and support for mental well-being. Our welcome to Shanti Das. And finally, Kathleen Ethier is a social and behavioral scientist at the Centers for Disease Control and Prevention in Atlanta. We've heard a lot about them over the course of the last 10 weeks. Proximate to the response, she's the director of the Division of Adolescent and School Health, DASH, in the National Center for HIV, Viral Hepatitis, STD, and TB prevention. In Spanish, we call that a trabalengua. That's very hard to say. That's hard to get out. She recently completed a rotation on the CDC's COVID-19 response as the lead for the Community Intervention Task Force. A very important work, provides guidance on preventing the spread of COVID-19 and monitors the social and psychological impact of the pandemic. Thank you, Kathleen, for joining us. Let's get started, guys. Let's get right in. I guess I should start by saying sort of why I'm here. A couple weeks ago, it's better to assume that you guys have no idea that this happened, but I went on national television and opened up about my own clinical diagnosis of post-traumatic stress. I have suffered for a long time quietly, privately, something that, the stigma in my community, I felt didn't allow me to come forward. And what I've seen and heard in my conversations over the course of the last 10 weeks is that this pandemic has pulled the curtain, just shown us the ugliness of sort of what life is, and has really pulled back the curtain on a lot of our lives. I feel as though it's become the great equalizer. And in our conversations, my family's conversations, Black, brown, white, people of color, poor, rich, this is something that we are all dealing right now. We are warriors, those of us that go through these mental health struggles. We are fighting a battle every single day. And we hope that you learn something today. And we hope that that battle becomes easier for you after this conversation. I want to start by just opening up with a question here. First question goes to Dr. Byrd. What do you make of the increase in mental health discussions among general public and even the workplace since the pandemic? Do you think that decreases the stigma, Dr. Byrd?
Eve, you're on mute.
I think,
Sorry about that.
Yeah, no problem. No problem. We'll work through this. People understand.
By saying, thank you for sharing your story. That will help millions of people. So thank you very much. Yes, the pandemic has normalized having a discussion around our mental health and well-being. For many individuals, families, as you mentioned, communities, and even employers, I'm very pleased that this is a hot topic among our Carter Center staff. The health community has known for years that social isolation, uncertainness, really has a detrimental effect on one's mental health and actually physical health as well.
Yeah, it's like that feeling of being alone, right? It's like we're all doing this together, but we're really doing it, feeling by ourselves,
Yeah, and we've tried very much to address that among our older adult population, persons with mental illness or other disabilities. But I think the pandemic has now increase that conversation among all of us, no matter what age you are, no matter what your situation is. There's just much more conversation about that.
That's uplifting to hear this, as someone being at the forefront of this conversation, leading this charge. I mean, here we are in 2020, and you think that we're so, past some of these, stigmas, but we're still dealing with it, which is why we're talking about it. I want to go to Nick Kristof here. Your most recent book, we talked about it in your introduction, Tightrope. It examines health inequities experienced by rural Americans. It's something that, I think doesn't get enough coverage in the news, just, the lack of healthcare, mental health facilities in rural America. How do you believe that the pandemic has widened that gap? And how does the inequity affect mental health and the stigma?
Well, greetings from the family farm in Oregon, which was one of the vehicles in Tightrope to talk about these issues. A quarter of the kids on my old school bus here in rural Oregon died from deaths of despair, drugs, alcohol, and suicide. Wow. And I'm afraid that the pandemic exacerbates all these problems. I mean, essentially what happened in my rural community was that people lost jobs and they became socially isolated. And that led people to self-medicate, that led people to feel a loss of self-efficacy, and in ways that damaged their physical and mental health, and ultimately in many cases led to their death. And we see this nationally. You know, deaths of despair were associated with falling life expectancy for 3 years in a row. And I'm afraid, you know, what does the pandemic do? Well, it leads to unemployment surge to somewhere around 20%.
Yeah, and you have a lot of time to think about just how bad your situation is, which only, you know, just really exaggerates the problem that you're probably suffering through, right?
That's exactly right. And the, you know, the virus preys on our social connections. It has learned, it has evolved to take
Wow.
advantage of these connections. And those connections are precisely what we need, especially at a time of job loss.
Yeah,
I
we
was a
need
little
human
curious.
interaction. Human beings need that social interaction. You know, my father-in-law, you know, he always talks about being a fan of social capital, and you know, right now we're not getting that. We're not getting that human touch, especially those that are living alone, elderly. The next question is for Dr. Ethier. Kathleen, the rate of diagnosed mental health conditions in children and teens has gone up. What do you think about this generational conversation? Do you think that younger people are more open to talking about it? I mean, I guess I still kind of consider myself youngish, you know, but like I'm still, you know, not very comfortable. But you see sort of, you know, not just in pop culture, but just, you know, in conversations on a day-to-day basis with high school kids, it kind of seems a little bit more of a norm for them.
Yeah, the digital generation's really grown up sharing all aspects of their lives on social
Yeah.
media. And while the research suggests that there's positive and negatives to this, I think talking about mental health issues more publicly can only be a good thing. Just this week on Instagram, there was a challenge to talk about how do you feel really? And I saw a lot of both, you know, friends and also celebrities really talking about their experiences with depression recently. And that's a good thing. I think it gives young people the words to talk about what's happening inside them. I mean, even before the pandemic, our data was telling us that mental health was moving in the wrong direction for young people. For the last 10 years.
Can you expand on that?
Yeah,
What do you mean?
sure. I'll talk right over you. For the last 10 years, we have a measure of mental health that we've been tracking for about 30 years. And in the last 10 years, we've seen real increases in the proportion of high school students who said that they felt so sad or hopeless that they couldn't participate in the regular activities. And in particular, young women and LGBT youth have been primarily really affected over the last number of years. So I think this can only have been impacted negatively by the pandemic, as for all of the reasons that you're talking about in terms of social isolation, but also school closures are really going to have a very significant negative impact, because schools are a real source of connectedness for youth. And we know that school connectedness has a long-term impact on the health and well-being of youth and then into adulthood. So we're really concerned about schools being closed and those really kind of essential relationships and infrastructure being gone for youth for this length of time.
And you talk about social media, you know, and I wonder just how much that has actually played into potentially, you know, the mental health problems, the anxiety, the depression that people have. You know, I'm guilty of it. I'm, you know, we have, as public facing people, we have to maintain a strong social media presence. You know this, Nick, you know, and yes, we are open and we try to share, but it's also like, are we really, you know, how are we feeling really? And I'm glad that you brought that up. I want to circle back. We'll get back to some of those points that you made, but first to Shanti. Ms. Doss, you started an advocacy organization to fight stigma against mental health, knowing that COVID-19 is disproportionately affecting Brown and Black people in America. As another panelist here, a person of color here on this panel, I want to ask you what some of the key factors that could reduce that stigma, specifically in those communities, in our communities, in the Black and Brown communities, and really others, you know, we could expand on. But let's talk about Latino and African-American communities first.
Sure. So first, I'd like to say it's a real honor to share this virtual stage with all of you today. So I'm excited to share. There are so many disparities in regard to mental health services in the African-American community. I want to read a few statistics. African Americans often receive poor quality of care and they lack access to culturally competent care. Statistics show that 1 in 3 African Americans who need mental health services actually receive it. And also, we're more likely to use emergency rooms or primary care rather than mental health specialists. You know, I grew up obviously in African-American culture. My dad was of Indian descent. My mom's Black, but my father took his own life when I was 7 months old. And we didn't talk about it as a family. And the pain and just watching my mom, I could see her crying all the time. She was so depressed. She never shared anything. And so
And you're seeing this as a child, right? And trying to sort of process this. Yeah.
So the trauma of that, you know, was really difficult, and we kind of compartmentalized all of our feelings. So you fast forward to me being an adult. When I started experiencing a lot of stress and adversity in the workplace, I didn't know how to handle that. And in 2014, my best friend took her own life. And I came really close to taking my own life in 2015, and I started talking about it. So that's the one.
But before that, though, what kept you before you opened up? You know, and then going back to what you said about you know, your mom and sort of not addressing the elephant in the room. What is it, you know, to explain to the people that are watching here? What is it culturally? You know, what is it about our communities that doesn't allow us to feel safe to come forward and share our truths? Speak our truths.
It is that shame and stigma, right? It is debilitating at times. No one wants to be called the C word. No one wants to be called crazy.
Crazy.
And also in African-American culture, you know, we're taught to just pray our problems away. And we're also taught to keep our secrets. You know, you would hear your aunties and grandmothers saying, don't go out there telling our business, and people don't need to know what's going on in this household. And if we did have family members that suffered from a mental illness, it was very hush hush. We didn't talk about it. I had a cousin who suffered from schizophrenia, and it was embarrassing for us to even talk about it. So I think we're seeing strides being made right now in terms of those key factors. And it is, you know, doing that talking about it. I started publicly speaking about my own suicidal ideations, and even losing my sister last year unexpectedly. I have shared my grief journey publicly on social media. And Nick, I gotta tell you, people email me, tweet, text, and say thank you.
I know how popular you are.
No, but in all seriousness, they tell me that I am helping them through the process of being open to sharing and seeing clinicians. I mean, this is huge for our community, because for so long we thought therapy, I hate to say it, but you know, we would hear, oh, therapy is just for white people if you grew up in African-American culture. And that is so silly, you know.
I want to jump in here because I want to, you know, to jump to Nick, you know, because I think it's really important to talk about rural, the rural community and how that lines up and the parallels between, you know, our communities of color and what's going on in rural communities. Does anything that Shanti is saying resonate with you, Nick, having grown up in rural Oregon?
Absolutely. And, you know, so my community is basically lily white. And in the 1990s, there were a lot of really pejorative comments made about African-American communities and about how, you know, people just need to lift themselves up by their bootstraps. This is about bad choices. This is about
be brave, be strong. Yeah.
All these, you know, we've all heard these. And meanwhile, the great Harvard sociologist, William Julius Wilson, said, no, it's about lost jobs. And he was exactly right, because when lost jobs came to Yamhill, Oregon, the same pathologies unfolded just, you know, 20 years later. And I think that there's you know, I think there are a lot of very strong parallels. It's just that this came later, and also the public response was somewhat more compassionate when it was white people who were struggling. And we changed the framing, you know, from, we don't talk about junkies, we talk about people in need of treatment, et cetera, in ways that are double standards and hypocritical, but may actually also lead to a better policy response.
Let's, very smart point, very astute observations here. Let's jump to the exact opposite spectrum here, Dr. Byrd, and talk about celebrities, people that, you know, are living comfortably right now. And, you know, there's 40 million Americans who are, you know, maybe not going back, millions may not go back to a job that they have, you know, but you see these public figures, and I guess I'm one of them coming forward, right? I mean, what does that do when people see someone that looks like them, that they are used to seeing on television or on the big screen? What kind of impact does that have on our society?
There's a great deal of research that shows that social contact is, and perhaps social contact is not the right term to use in the presence of COVID, but that what I mean by that is that by being able to relate to somebody who is telling their story, and their experiences, then it becomes all right to share your experience as well. And in fact, it's somewhat therapeutic to be able to have that connection there. So
yeah, in
whether
the
you're
absence
relating
of this social interaction, you see you're reaching to try to connect with somebody, right? Yeah.
Right. So whether you relate to a celebrity, or whether you relate to your teacher, or you relate to your mother, or you relate to your neighbor or your friend who is also having similar, that's extraordinarily important. I did want to also interject that I think as health professionals, we further stigmatize when we don't talk about mental illness on the same platform as all health illnesses.
Why don't we
Or
do
health
that?
condition.
Why don't you think we do that? And I want to jump
I
to
think it goes
Dr.
way
Ethier
back
after
to
this.
the stigma, as if the brain wasn't connected to the rest of the body, or perhaps that we had total control over all of our behaviors, or our super computer, our brain, and it's a brain illness. And one thing that we are really supporting is that during this time of COVID, that we not only talk about wearing your mask, physical distancing, washing your hands, but also in the same breath, in the same message, telling the CDC, World Health Organization's mental health support guidelines that are take care of your mental health, connect with someone who you trust and that is positive in your life. Be intentional about that. Pay attention to your sleep and your health and your physical activity, and don't take on things that can be unhealthy, substances, and then also to really intentionally plan an enjoyable activity, something that you have control over and that you can plan on and look towards. And then finally, I have to say here, with being in this this press club supported event, we have to also individually limit the amount of news, time on social media, figures and data and all, because it increases anxiety in all of us. Of course, we want to be informed by accurate resources,
Yeah.
but at the same time, the constant can be very difficult.
Can you just go off of that a little bit, Kathleen, and then we'll get to you, Ms. Doss here. And I'm sorry I dropped off. I'm just having some internet problems here. Oh, you're muted, Kathleen. I'm not the only one having problems. Oh no.
Oh,
there we go. There we go.
Am I unmuted?
Yeah, go ahead.
Okay.
Yeah, we can hear you now. Go ahead.
Yes, I absolutely agree. I think that we have to find a balance between using our social media and our technology for connection, because in many cases we are asking people to social distance. And then at the same time, we are also asking people to not be overwhelmed by kind of the barrage of everything that can come through social media. So finding that balance of relieving anxiety, but also maintaining connection is incredibly important and also really difficult. And I think also for kids, adults have to help kids in their households and in their communities figure out what that balance is, especially when they're also having to do school online. So it is, I think, very much about finding a balance and being observant and aware. I mean, I think back to, Nick, your original question about celebrities and people talking about what's happening with them in terms of mental health issues. I think that's incredibly important to model that for other adults and for young people, but I think it's also important within families and within communities. And so I think, you know, many parents feel like they need to keep a stiff upper lip, but I think back to Shanti's point, that it's going to come through. And so I think really actively talking about and making it okay within families to talk about what you're experiencing is both good for parents to be able to share, or grandparents who are in the same household to be able to share, but also to model that for young people so that they understand that's really important and okay.
And I just wanted to quickly add about celebrities helping to reduce stigma. That has been one of the main strategies with Silence to Shame. In 2017, I created my own day. I said, I'm going to make May 5th National Silence to Shame Day. And I created a little graphic and asked some of my celebrity friends from the entertainment business to post. Nick, we received 90 million impressions in one day. And that was in 2017. And we kept that going. So now May 5th is National Silence to Shame Day. We have a bunch of celebrities that engage. I also created a platform on my Instagram called Yeah Wellness, where I interview celebrities like Ludacris and Common, Carrie Hilson, athletes like Chris Webber. And I gotta tell you, it has been, I think, so helpful for our community of followers and participants. We are getting more and more people coming forward. As we're having these conversations, people are in the chat room like, oh my God, because Ludacris is talking about it, I'm gonna talk to my son, I'm gonna talk to my niece and my nephew. For whatever reasons, you know, in our communities, we hold these celebrities, right, to high standards. When we look up to them, our kids look up to them. And so for them to help normalize the conversation is helping tremendously. No, I don't think we can hear you, Eve.
I just want to interject. I'm reminded of a slogan that the National Alliance on Mental Illness has used for years, and that is, it's okay not to be okay sometimes. And I think that's particularly relevant right now, but was relevant before the pandemic. And I do think that these conversations are allowing people to recognize that in their neighbors and their coworkers and their families, that we're all under a great deal of emotional and otherwise stress. So it's okay not to be okay. But what's not okay is if we don't do something about it, and our workplaces and our policymakers don't provide the opportunity for us to care for ourselves and remain healthy.
I'm going to jump in here because I think we lost Nick Valencia for a second again. One of the things that we want to know from everyone is about healthcare workers. They're a very vulnerable group during the pandemic. What's needed to make them feel like it's okay to speak out about what they need? I mean, the stress of being a hospital worker right now is immense. And so I think they need a way to be able to have that ability to share their voices without having the stigma, are you fit to work? So if anybody wants to jump in on that.
I'm a nurse, and I will jump in. It is just totally, it needs to be embedded in the workplace. The ability to talk about the stress and the trauma that our healthcare workers are going. We've seen numerous spots on the news about how people, even healthcare workers that are used to life and death situations, are being put in and made to make decisions that they've never encountered in their whole career. Very concretely, it's just unacceptable for a nurse to lose a patient in the ER and there to be a moment of silence and a review of what could be done better, and on they go with the rest of their day, and even come back in the next day facing the same. And I really do believe, because we know that at-risk people should all be screened, that our employees that are at high risk, for whatever the reason may be, that I think that includes healthcare workers, it definitely includes journalists, it includes a number of other professions, and individuals just because of their social and economic situation are at risk. So we really need to be embedding ways to prevent and early intervene. So people, it's just commonplace for you to share that today's not a good day, or this is what I'm dealing with, and this is the kind of support I need.
And I'll just add to that, I have a good friend of mine who is a nurse in an emergency room in New York City. And she's been calling me every few days. She was going from the hospital to the testing site, you know, testing, working 10-hour days. She's extremely stressed out and obviously experiencing loss and death in unprecedented ways and numbers. And it was just so much on her. And, you know, we had a candid conversation about, you know, what does this look like in the next few months? The trauma that she has seen in the emergency room is heavily weighing on her. She's having trouble sleeping at night. So it needs to be incorporated and mandatory that I think our nurses and our doctors are seeing a therapist. Even if they can't do it on a weekly basis, you know, it should be mandatory that they're doing it at least twice a month. You know, look at the doctor who took her own life in New York City almost a month ago. I think it is just too much on our healthcare workers. We're expecting too much from them, and we have to make sure that them being able to see a therapist is a part of the process.
Also just wanted to, hi Nick,
Hey, I just had an anxiety attack there. That's super. So I'm glad to join you guys back. We could talk through this here as a therapy
We're
session.
glad you're back. We're
Gracious.
glad you're back.
Oh my goodness. I'm sorry, Sheena, for giving you a heart attack, by the way. We were trying to connect. Anyway, this is not about me. Please go on.
I wanted to add to something that Shanti just said, to say, we've learned a lot over the last, I'd say, 20 years about PTSD and how to address it. There are no kind of sure, out of the box cures for PTSD. But I do think that we need to assume that healthcare workers coming out of this experience are going to be experiencing PTSD,
Right.
and that's going to last for a long time. And I think we need to be both doing some early intervention now, so whether it's providing on-site mental health care for healthcare workers, but also realizing that that's going to extend on, and that that's going to be a need that's going to be there for a long time. And
do you
also,
think that there's a focus on that happening right now? Is there actively conversations at the CDC talking about how to get better care to those healthcare workers that are on the front lines?
I think we're still very much in the middle of everything. So, but I think that there are other groups who could be really helping. And so putting that out there to say, please consider what you know about PTSD and how to treat it, and making it available for first responders and healthcare workers.
Shanti, I see that you have your hand up there.
Yeah, I was just going to add to what Kathleen was saying. One of the things, Silence to Shame was raising funds in the month of May, and we're going to be giving a portion of the proceeds to nurses so that they can seek treatment and therapy in the Atlanta area.
That's right.
How much does data play a role in reduction of stigma and these statistics that we're talking about? The virus, such as death rate counts, case counts. People are feeling overwhelmed by the numbers and just the data that's coming out. Sharing fears like that. I mean, can we talk about that and touch on that? It's open for anybody.
So I don't think the data in general is helpful. I think stories change people. I think their acquaintances change people. And I think I'm actually, to some degree, dissent from perhaps an emerging consensus here that this crisis is going to help us reduce stigma in mental health. I'm not.
What gives you hope, Nick? What gives you hope?
So I think that there is indeed a possibility that will happen. And you look at what happened after the Great Depression, and you had much better policy responses at every level. But I think it's a mistake to think that's inevitable. And, it would seem that we should have learned by now that wearing a mask is a pretty good response to this. And yet that has become a hugely polarized issue, and people assert their invulnerability by refusing to wear a mask. And I'm afraid that they may also assert their invulnerability by refusing to seek help on mental health issues. And
you're almost talking about like a politicization. I mean, I've heard people call COVID-19 a liberal disease, right? We've heard those types of statements. Yeah, go on.
I mean, I think that's exactly what's happening, and I see that here in kind of rural, less educated America, especially white America, where one asserts one's identity by not wearing a mask, by asserting that this is not a serious problem. And likewise, if you look at the policy response, you might think, well, after the 2008-2009 financial crisis, those lower down in the socioeconomic spectrum were particularly badly hit. Did we address those issues? No. We rescued Wall Street, and we let 10 million lower income Americans lose their homes. It's not obvious to me that we will respond to this crisis by increasing access to healthcare, which would, seem to many of us to be the obvious response, to improve access to mental health. I think that, again, is possible, but note that the immediate policy response of the United States government was not to address these issues, but rather to provide $135 billion to rescue hedge funds, even as we let 36 million Americans lose their jobs in a way that does not happen abroad.
I see Dr. Byrd there nodding her head, but before we get to her, I want to ask, while we're talking to a journalist, what can journalists and other members of the media do to help reduce that stigma of mental health issues? And I want to get the policy right after that from Dr. Byrd.
So, I mean, Nick, I think that what you did is really important. We talked about this a little bit before about, having people who others identify with stepping up and talking in personal ways. I think that, if you think about attitudes towards LGBT issues, then what changed public feelings very quickly as public opinion changes was not data, it was not arguments about justice, it was suddenly discovering that one's cousin or some other family member or one's good buddy was actually gay. And I think that likewise,
it's knowing somebody, it's having that, seeing somebody in the eyes and being able to personalize this broader issue, right?
That's right. And, as a society, the problems that we have the worst public policy toward are those that are hard to talk about. Anything to do with sex, domestic violence, mental health. And so when the way to shatter that is indeed to have a human face of somebody one cares about and discover that they are, gay or wrestling with a mental health issue or whatever it may be. And I think that's the avenue toward better policy. But
Dr. Byrd, can you jump in here? Can you expand
I will.
on that?
I mean, I agree with Nick very much. I think that it's very important to tell those personal stories. And I think it's also helpful to work with journalists and how to do that in a compassionate and also an effective way. Also, language really does matter. Shanti used the term crazy earlier, or insinuating that people have mental illnesses when they're just not behaving properly
words matter.
Totally inappropriate and stigmatizing. So more of that is definitely needed.
Yeah, I want to get to Kathleen. She has her hand up here, and I have another follow-up question to that.
I do want to put a quick plug in for data. I think what's allowed us to pivot somewhat in the work that we've been doing in my division for a while has been to, once we saw a real increase in mental health issues and we saw increases in suicidality among youth, it has allowed us to then kind of pivot our work in that way. It called attention to an increasing problem that we've been able to think about addressing. I completely agree that both the importance of people's stories and sharing those stories are invaluable. And I think in terms of reducing stigma, yes, absolutely, those are just unbelievably important. But I think in drawing to attention to an issue and to drawing attention to something that we need to address, we do need to really have those good data systems in place to tell us what's happening. So just wanted to.
Yeah, well, of course, the scientist is going to plug the data. We got,
Right, definitely.
Shanti, I want to open up this question here, because you're in the.
One last thing that I think is really important. Sorry, because data is extremely important, right? We're not able to really put procedures and processes in place in various communities. But I will say this much: historically, African Americans have really felt underrepresented in research data. I have to just say that. And oftentimes, even my friends who are educated, we're a little bit leery sometimes when we look at the numbers and we look at the data.
Why though? Why don't you think where's the why isn't there a connection there? What's the gap?
Because oftentimes the data just doesn't look like us, in terms of the number of people that are pooled, the communities, the rural areas versus the inner city areas. Not a lot of people in underserved communities are always the ones that are going to participate in surveys. So
it leads you to not trust what's being presented.
Yeah, I mean, it's not like we're fighting against, the CDC. We certainly look at the CDC and every other organization that provides the data.
But doesn't that now make the onus on us as leaders in the community to start to sort of have these conversations and say, hey, look, this is real data. This is real science, like that's where we can be people that help that. Usher that in.
That's why when I do a lot of my community conversations, we often refer to the data so that people can see, yes, this is happening. This is something that our community has to address, whether it's physical health disparities or, mental health or things that we need to do in terms of helping to reduce stigma. But I just wanted to bring that to your attention.
No, very important.
Absolutely agree.
We have to continue to educate, right? And talk to these underserved communities about understanding what the research and what the data really means.
Right. Well, you've got a friend in the scientist here, any data plug. So I want to talk about this because, Nick, as a fellow journalist, those journalists journalists that are tuned in here right now, we traffic in bad days, in the worst days of people's lives. And, you know, it's like the car wreck. People don't want to hear, especially right now, how great people are doing. No one wants to go on social media and see what a happy family you have while they're going through it, right? Having said that, we have a question about how the media plays a role in mental health. How do you think, I mean, is there a risk? You know, I mean, at the same time, like, you know, I have a 2-year-old daughter. I want her to be informed about the world, but I also want her to be happy. And I find those sometimes those two things don't often go hand in hand. This question is open for him.
So, I mean, I think there are two ways we can do better. So one, there's an area called solutions journalism, which is about showing how there are some communities or some folks who have taken an issue and actually done something about it. And the challenge is building an audience for it. People are more likely to click on that car wreck that you mentioned, Nick. But, you know, look, we in journalism, we ask for various special privileges, and many of us went into journalism because we considered that we bring something important to the public. So I think it is fair to demand that of ourselves and to have people hold us accountable for that. And I think that we can also do more to illuminate some of these issues that are hard to talk about and make them subject for conversation in ways that are one step toward deriving better policy.
Kathleen, do you want to jump in here?
Yeah. No, I absolutely agree. I think I think really incorporating that into our conversations is incredibly important.
Can I jump in and say,
yeah,
Nick, I'm sorry.
No, go ahead.
The solutions-based journalism, and a little bit more on that, is extraordinarily important because the stories are difficult. And for the journalist to tell, for the person who's struggled to tell. And there's, as I mentioned, a way of doing that appropriately with language and compassion and those kind of things. But there also needs to be that and you asked this, Nick, in one of your questions, what is the hope in that? And there is always a hopeful message. There is always a hopeful message. Yes, the family that has nothing going on and COVID is just not real right now. But there are hopeful messages in each one of our individuals, families, organizations struggle, and ways of doing that, as I mentioned earlier, really driving home those very simple, positive messages about how you take care of your mental health in the midst of this is extraordinarily important.
I want to pivot to Ms. Doss here about taking care of your mental health, because, you know, I've been in therapy for about 2.5 years. It was just in January that I was diagnosed with my own condition, and it took a lot for me. It took a seismic event, like a force of nature event for me in a bad way, to reach out for help. Do you think that in our communities that therapy is something that, you know, you mentioned this just for white people, you know, is this something that like we're open to? You know, I mean, what do you think coming from, you know, your perspective?
Sure. I think that now more so than ever, people are more open to therapy. Again, it goes back to people sharing their personal stories. So, you know, utilizing social media to share those stories. We're seeing more and more people, everyday people, celebrities, influencers, open up and talk about how therapy is actually a good thing. Singer and songwriter Carrie Hilson opened up publicly for the very first time on one of our panel discussions about her depression for over 7 years. And she talked about how so many of her fans after that said that, you know, they were actually okay with going to see a therapist. I think it's also important in our communities because, you know, sometimes we'll try one thing, we'll try something rather once, and if it doesn't work, then we're like, oh, I'm not going to do it anymore. So right. I hear some of my peers sometimes say, I tried therapy once, but it didn't really work for me. It's incumbent upon us to continue to tell people, you know, therapy's like dating sometimes. You got to go on a few dates and you find the right person.
I went through 6 therapists before I found my therapist, honestly, and I've been with her for 2 years, and I love her, right? She's great.
I think at this point it would be helpful to interject because the general public does not understand what therapy means. And I think if you ask a million people,
put it out there.
They would say, oh my gosh, I'm not going to be laying on the couch and
right.
Sigmund Freud ask me my most deepest, darkest thoughts.
That happens though
That's not what
sometimes.
it
You know,
is.
I had the scab peeled off yesterday, and you know, sometimes it's uncomfortable.
And that's frightening. That's
Yeah,
frightening.
it's uncomfortable.
You have to have a relationship where you feel some connectedness to the person. But that therapist is there to help you, teach you different ways to thinking about things, different ways to reacting to situations, because sometimes we learn coping mechanisms that are not as healthy for us. Do some fact checking. We begin to stew over things and make mountains out of molehills. And so therapy is really an educational activity, if you will, with someone that's trusted and that you can relate to and share and learn why you're thinking the way you are, why you're behaving the way you are, and more positive ways of interacting with individuals and socially. So,
yeah.
I want to use this as a, go ahead. Did you
No,
have
I just wanted to say, and I think similarly to talking about mental health, I mean, I think this is probably the hopeful part of it, is similarly to talking about mental health issues, I think it's really important to also talk about the solutions that you found, therapy being one of them. And I think being able to, we were laughing about this at my house last night about, you know, we are a family who really believes in therapy. And so, and talking about that and saying that, and I think, Nick, you know, what you've said about your own experiences with therapy, that's really powerful, because one, you get to kind of make it less mysterious, to Eve's point. You can talk about what your experiences in therapy have been like. And I think it makes, and then I think you also can help provide those resources to others who've been thinking about looking for that kind of support. You can help bridge that gap. So
well, talking about bridging the gap, you know, therapy, and I think I should be very fair here, it's cost prohibitive, right? I mean, you know, people can afford it, who can afford it. What I've done, and knowing that my community, you know, there are people in my club as a role as a conduit of getting information, of getting that information and giving it back to people that may not be able to afford therapy. I act as that sort of liaison and use the tools that I've learned and impress them on others, on other younger journalists that I mentor, to try to help them out, you know, and to try to, you know, they don't have to pay the whatever fee it is, you know, insert 3, you know, digits here fee per hour. You know, this is something that helps us, you know, end the stigma and bridge our communities together. I want to use this as a jumping off point here to talk about, because this is the Atlanta Press Club, and thanks as well to the Carter Center, but this is really mental health and self-care for journalists. And we're talking about the stigma, and we're talking about it out loud right now. But man, if I didn't tell you that I was so nervous about speaking up and saying what I was going to say, because I thought I was going to get in trouble. I thought that the first time I started mentioning it to my bosses, that I was going to be taken off the big story, or that I would be considered as weak or unstable or unable or unable to remove emotion from a story, when I feel that my compassion is what really connects me and my authenticity. Nick, can you to Nick Kristof here, can you tell me, you know, in your career, how you've seen that change through newsrooms that you've worked in and journalists that you've spoken to? How have you seen that stigma change over the course of your career?
So there's certainly been a vast change, and journalism, I think, like a number of professions, tended to be very much about kind of a chest-pounding, rugged individualism. You know, I'm going to go out and, you know, war correspondents tended to shape a great deal of journalistic values from Vietnam on. And
the great Ed Bradley shaped me.
Yeah, and those who tended to be most respected were those who, you know, turned a blind eye to danger and didn't acknowledge any sense of vulnerability. And I think that resulted in 2 big problems. One, you know, on the physical side, we lost an awful lot of journalists in Iraq, in Afghanistan, elsewhere, in Syria. And the other was that because people didn't talk about mental health, and for precisely the kind of reasons you mentioned, Nick, so there was an awful lot of suffering that people were uncomfortable discussing. But I think that has changed, and I think it's part a, you know, revolution in attitudes toward mental health, especially at the...
It's changing. We're changing it right now. Conversations like this change it. I believe that.
But I think that it has changed for the more educated end of the spectrum, and rather less so for the other end of the spectrum. So I think that journalistic communities have been more willing to address these issues. It's not obvious to me that that is true across the workplace and, in general.
Can I just add to your point, Nick?
Yeah.
I was on Instagram and I saw a friend of mine that was a peer that I thought was going through it. And I put in the comments and I said, hey, hope all is well. I said, are you seeing a therapist? And it really came from a place of love and concern. I gotta tell you, there were so many trolls that attacked me with my comment. What do you mean? Why should he see a therapist? And these were people within the African American community, and they were attacking me. You're the one that should be seeing a therapist. So I agree with Nick Kristof's point that I don't think it has trickled down into some of the underserved communities and less educated communities. So there's still a ton of work that needs to be done in those areas.
Nick, I gotta
go
add here in that, building on your comment that you tried to help those that are unable to afford to see a therapist. And that's a crime in and of itself. We have federal legislation in this country that mental health services should be paid on par with other physical, and our states are simply not enforcing that. And this is a major initiative of the Carter Center, because you should be able to see a therapist to get evidence-based treatment, just as medications and such. Mrs. Carter has said for years that the fact that our insurance company doesn't pay on par for other physical illness is stigmatizing in itself.
Yeah.
People begin
I was
to
worried
think,
coming out with my,
you have to be rich.
Yeah.
Right.
Yeah, I was worried that what it would
do
do for me negatively, insurance,
Yeah.
like you think about all sorts of things.
Why
I'm
are
sorry
you
to cut
needing
off.
something that the medical community or medical payers don't feel is necessary? And this is just wrong. It is further stigmatizing, much to say also decreasing access to the general public's access to evidence-based treatments.
Kathleen, do you want to jump in here really quick, and then I want to get to a point right after Kathleen.
Yes, no, I think the Carter Center has done just an amazing job, and we're always so happy to partner with them on these issues. I think also incorporating mental health into public health and realizing both the relationships between physical health and mental health, but also being able to work on addressing mental health as part of public health, I think is invaluable. We work very hard to deal with disparities and rural health issues. And so I think the more that we can really make sure that we're incorporating mental health into all of our public health programs, the better off we will be able to address some of those issues.
That's such a great point. Nick, I'm gonna open this up to you here, because we only have about 8 minutes left, and I feel like we haven't really even addressed this at all. And I think it's germane to mental health issues is substance abuse. You talk about all the journalists that we lost. I know that there are colleagues of mine that self-medicate. I know I've been guilty of it myself. There's my cat. He's coming here to make me feel comfortable. He knows I'm nervous here. I feel as though, I think that's an issue that we don't often talk about and address, and it's like underneath the surface, especially for journalists. You go to the bar to socialize and you tell your war stories, right? And you pound your chest about what you just did in news gathering. How do we get past that? Is that the next step, or am I jumping too far? I mean, how do we start, because I see those two things as connected. They were certainly connected for my life.
Oh, absolutely. And, indeed, you look at the numbers, you think of 68,000 Americans dying a year from overdoses, 84,000 Americans dying from alcohol-related diseases. I mean, those are staggering numbers. I do think that, what the discussion has underscored the importance not only of addressing stigma socially, but also a better policy. The idea that 14 states still haven't expanded Medicaid in the middle of a pandemic. And I think that we have a chance to improve that policy post-pandemic, that this catastrophe has underscored the gaps and have underscored that in a time of infectious disease, as opposed to chronic disease, that all of us are only as protected as anybody else in society, in a way that is not true with chronic disease. So that may create greater leverage to bring about universal access. But I guess what I'm afraid of is that there is
we have about 5 minutes, 6 minutes here left, and sorry.
Okay, that policy response, we have to make sure it's not just about coverage of COVID, but also brings in all these mental health issues that we've talked about as well.
We have about 5 minutes left here. Shanti, do you want to make?
Quickly, I was just going to add, behavioral health and substance abuse really go hand in hand. So whenever we're doing community conversations with Silence to Shame, we talk a lot about the effects of one and the other. For me, when I was going through my suicidal ideation, I was drinking and I was using it as an unhealthy coping mechanism. And we've seen a lot of our celebrities who self-medicate and talk about it on a regular basis. So we are making sure that we include substance abuse in all of our conversations around behavioral.
Wonderful. That's wonderful. In these last few minutes that we have left, I think it's really important. We've talked a lot about, our personal journeys, just sort of how we can, end this stigma, how we can continue on the journey that was started so long ago, the foundation laid by Ms. Rosalind Carter. What resources are there out there? And I know we're putting some stuff up here in the chat. The DART Center doing great work. I spoke at the Society of Professional Journalists last year, and they were there. I know they've dedicated to helping those in our community. For those that are listening, and this is again open, maybe we start with the public health professionals first. Tell us about the resources. What can be next steps? If I'm somebody listening right now and I say, man, I really need to get some help. This has really convinced me that I need to address a problem. Where can we go from here?
I would start with the distress hotlines. There is a whole array of, and they're really good. I mean, they're way beyond what I think we think of as the quote unquote suicide hotline. I think they're staffed with really wonderful, caring people, and they cover an array of issues. And I think they can direct people to local sources of support. So just at a national level, I would really start there. I would also look to the people in your own life who can be supportive and can help you. And I think you will find that you will, and I just think we can continue to say that, so you will find that there are people out there who can listen to you and who can provide support and who can tell you their own stories. And then I think lastly, I would say the work that you all are doing, whether it's through journalism or whether it's through the programs at the Carter Center or whether it's through the non-governmental organizations like Shanti's, I think all of those kind of coming together to present these messages are just invaluable. And I know in public health, we appreciate them so much.
Thank you so much. I want to open up to the last words for every one of you, and I'll make some final remarks. So Eve, you want to go, and then Shanti, and then you could wrap up?
We shouldn't underestimate the power of prevention and early intervention.
Mm-hmm, yeah.
For those and healthy lifestyles, for those with mental illnesses, but for those of us that are struggling during a very stressful time. And the CDC and the World Health Organization provide very helpful, concrete guidance. And I think some of these resources will be posted in the chat for all of us in the community. And we should really make certain and be intentional, I believe, in reaching out and connecting with those that are at risk or maybe not at risk, that we get support from. And then beyond the pandemic, keep these things that have worked really well in place and don't go back to our isolated media chats or whatever they may be, but really put these in place and really kind of demand of our employers and our government to create a positive environment for mental health and well-being.
We need allies. You're talking about needing allies, right?
Yep.
Shanti, go ahead.
I'll just quickly add, you guys can visit our website, silencetoshame.com. We have a resource tab there to a lot of other great organizations. We also have community conversations that we've done in the past on our YouTube page under Silence to Shame TV. As I mentioned earlier, we have a podcast with over 30 episodes on iTunes, Google Play, and SoundCloud. We interview celebrities, clinicians, and everyday people. And then I want to highlight a meditation app that I just learned about. It's called Liberate.
Awesome.
The app is designed by an African American, a person of color, and it's designed to support Black, Indigenous people of color on their path to healing by naming and offering resources for common cultural experiences like internalized racism and microaggression. So I actually just downloaded that app today, so I'm excited to try it out.
Thank you so much for sharing. Nick, you want the final words and then I'll close out?
I would just note that given the scale of our loneliness pandemic that is on the heels of the COVID pandemic, that we certainly need nonprofit responses, we need social networks, we need community institutions to respond. But, you know, we would never think of building an interstate highway system with volunteers and bake sales. Well, there's a recognition that there are some things that government needs to step up and do. And I think that when you look at the scale, the mortality, the morbidity of these kind of mental health challenges, then it's a reminder that we do also need a robust national strategy and public health response.
Thank you,
Thank
Nick.
you, Nick.
I'll take over from here. Did anybody else, did everybody get the
Amen.
chance to say? Oh,
And
Eve?
I just want to say,
Nick,
oh, go ahead. Yeah.
are you there, Nick? You're frozen. So
Yeah, I just wanted to say one quick thing
Okay.
here, Christy. We're all surveys of one. Oh yeah, can you hear me? Got me?
we can
Can
hear
you hear
you.
me now?
Yeah, okay.
All right. We're all surveys of one here, right? I mean, we're all speaking from our own personal experiences and what we've gone through. And I will tell you what is working for me right now, what is helping me right now as I'm going through this journey actively, you know, is leaning into the things that make me happy, making sure that I'm communicating with people, not further isolating. You know, sometimes you see the world around you collapsing and going, you know, crazy, and you say, well, you know, the world around me is blowing up. I'm going to be the one to do it. I'm going to blow up my own world because I'm desperate for control here. There are times that we all feel overwhelmed, and that's what anxiety is. You know, you get trapped by this feeling and overwhelming, and there are resources, and you are not alone. You are not alone. If there's one thing that I want everyone to know here that's listening, you are not alone. And I want to thank you so much for giving me this platform, to the Carter Center, to Mrs. Carter, to Christy, the Atlanta Press Club, and to all of you who have joined here, the panelists, our distinguished guests. Thank you guys very much for taking the time. Christy, I'll hand it over to you.
Great. Thank you Nick, so much. You did a wonderful job moderating. And thank you to all of our panelists, Nicholas Kristof, Eve Byrd, Kathleen Ethier, and of course, Shanti Das. And special thanks to our partner, the Carter Center. I believe very much in the work of the Carter Center and what they do. May is Mental Health Awareness Month. So we're going to show a final slide as people leave the meeting. If the panelists will just stay on for a few minutes, that would be great to finish up as our attendees leave. But thank you everyone for joining us today for this Newsmaker event sponsored by Wellstar. If you want to learn more about what we do at the Atlanta Press Club, see our upcoming events, make a donation, join as a member, you can go to atlantapressclub.org. You can also visit the Carter Center site, and they have some interesting mental health resources, and you can learn about their mental health journalism fellows at cartercenter.org. Thank you so much for joining us today, and we'll close with this screen. If anyone out there is experiencing any mental health symptoms that they need to get help for, we have this slide here with a number, so we want to share that as we leave. And thank you everyone for joining us today.